Testosterone is a hormone that is a sex steroid type of a hormone, and it's made by both women and men. In men, it's mainly from the testicles. In women, it's from the ovaries. And the truth is, how sex hormones are produced in both men and women is an identical process. And it's going through the same sequence. And again, they come from cholesterol, and several enzymes are needed to then finally get the final product being testosterone. And then one more step will bring you estradiol, which is the strongest estrogen for women. As a hormone, in women, it has to do with making muscle and losing fat. It has to do with energy and with libido, or sex drive, or sex desire. In men, it has a lot more things to do. It's involved in sex, in bone metabolism, in building muscle, burning fat when you're eating right and exercising, and then many critical brain functions, such as short-term memory, mood, motivation, sharpness, and an antidepressant effect. There is also some other benefits that occasionally I come across according to some clients, but these certainly would be exceptions to the rule. In there, it may improve sleep, may relieve severe pain that a person may have in a shoulder or arm after some injuries. But as I say, here again, this is unusual extra benefits that occasionally I see in some clients on testosterone. Testosterone is necessary for all the functions that we just mentioned. But the other side of the coin is that if you're deficient, and people can get deficient in testosterone at any age. I mean, I have clients in their 30s, in their 40s, in their 50s. And most of them are deficient for no obvious reason. Occasionally or rarely, there is a reason you can see in their history that you can say, well, this must be the reason why that person is deficient, such as, for example, being born with undescended testicles. But all the known reasons are very uncommon, so that most people who present with low testosterone, which is also called scientifically hypogonadism, can present in their 30s or 40s or 50s, and as I said before, there is no obvious reason. And if you do not correct their testosterone deficiency or hypogonadism, then you're going to allow that person to become high risk for a lot of degenerative disease, such as coronary heart disease, bad cholesterol, bad sugar, overweight, blood pressure, all the common presentations or illnesses that most regular doctors deal with all day long. And this type of evidence keeps mounting and getting bigger and bigger. In other words, the moral of the story is, if you want to stay young and healthy, and it's not just for testosterone, it really applies to all other hormones, you need to balance all your hormones, or any hormone that's deficient, it should be corrected if you're interested to stay young and healthy all your life. Of course, if that's your objective, then two other things come in, not just adjusting hormones. One is eating healthy with a few supplements, especially omega-3 and vitamin D, and the other is exercise. So that really the total picture for staying young and healthy for life is food, exercise, hormones.